Welcome. Now, this is not a boot video, but instead, I wanted to document my sinus surgery, which is going to include a septoplasty and turbinate modification. Now, I decided to have the sinus surgery and septoplasty for a couple reasons. The first reason is mainly I can never breathe through my nose. And it's been like that for such a long time. I'm just tired of it. At best, I can just breathe through one nostril, and I've just learned to breathe through my mouth. And this has been going on for such a long time. I'm just used to it. And but I'm always congested, and it just bothers me that I just can't be normal and breathe through my nose. So that's one of the reasons. The other reason is that I get these major sinus pressure headaches a lot, and I'm just tired of it. And it's just like this real heavy pressure. I can feel it on my forehead, my sinuses, my cheeks, and it's not comfortable, and I have to take a decongestant, which usually helps to kind of reduce the pressure or get rid of it and relieve it. But I'm tired of having to take these decongestants, or sometimes I'll be out doing something, and then I'll feel a sinus pressure headache coming on, and having to carry these decongestants, and then always having to buy them. And then just the pain of the pressure is just not it's not fun. So I finally decided to make an appointment with an ENT physician after all these years. I don't know why I didn't do it before. But I did, and I told him my symptoms, and he gave me an exam. He numbed my inside of my nose and stuck this long cord or tube or scope, basically, up my nose. And the first thing he said is, I can tell you have a deviated septum, and I didn't even know what that really was, but I was like, okay. And then he explained to me that there's this, cartilage that goes up your nose, and it kind of shifts. It's supposed to go straight up, but instead mine kind of leans over and shifts to a side, which causes a blockage, and that causes problems to breathe. And I was like, okay, that makes sense. And he also suggested trying these allergy sprays. And he said that may help clear things up, clear the congestion, help me to breathe better. And I was like, okay, I'm willing to try that. That's fine. And in the meantime, he also ordered a CT scan, because I told him I have these like really, really debilitating sinus pressure headaches constantly. And so I was taking the sinus sprays, and they seemed to help, the allergy sprays. And yeah, it kind of helped. And didn't have any problem taking them. And then, but you have to take them multiple times a day, and it's just sort of like it's just like a maintenance thing. So then I went and had the CT scan, which he had ordered, and it did that. And then he called me in for a follow-up appointment and showed me the images from the CT scan. Well, before that, he asked me how the sprays were going, and I said, "Oh, they seem to be okay." And but I'm having to take them multiple times a day. It's just kind of a nuisance. But then he decided to show me the images, and he showed me the deviated septum, and it was really, I don't know, kind of neat but weird at the same time to see. And it's like the septum is like this cartilage that goes up the center of your nose, and it's supposed to be like, I guess, just like straight. And mine like kind of goes straight. It starts out, and then it goes woo like that, and it like totally leans over to the one side. And I was like, okay, that I can definitely see that. It was kind of a trip to see. Then he also showed me my sinuses, and he said they were like inflamed, and he showed me something that he said was just abnormal, and it could probably be the cause of all these sinus pressure headaches. So I said, okay, I understand. It was neat to see that. And he said, I could continue with this allergy sprays, or I could have surgery. And he outlined what the surgery would entail and whatnot. And it was my decision. So Um, After thinking about it for a few days after the visit and whatnot and continuing with the sprays, I decided I wanted to go ahead with the surgery because I felt the way he described it, it seemed like it could definitely help alleviate the pressure in my sinuses, which is the main thing, and then also help me to breathe normal with by correcting the deviated septum. So I decided to go ahead and go for it. And so I called the doctor's office and let him know that I wanted to do the surgery. And he followed up with the insurance and they approved it because I've been having this chronic issue. And then he called me in for a pre-op. And when I went for the pre-op exam, he went over my medical history and, past any problems. Have I been through any surgeries before? Kind of, just making sure everything was okay. He went over the procedure that he was going to do. And I understood everything. It was really, really cool, really no problem with any of that. And then, he described that it would be under full anesthesia. And I've had some other surgeries before where I've been under full anesthesia, and that wasn't a problem with me. I was like, okay, I've done that before and whatnot. And so we booked the appointment for the surgery. It's in a surgical center. It doesn't have to be in a hospital. And one of the things I had to do immediately after that and before the surgery is to have a COVID test. So I had to go, and they gave me a referral to go get one, and I got one on the spot, no problem with that. And I also had to go get blood work done for them to review. And he also put in a prescription order for antibiotics as well as some pain medication for me. So after that follow-up appointment, I went straight to the pharmacy and picked it up. So I got both prescriptions ready. And he also gave me, or his office staff gave me, a list of items that I'm going to need and steps to follow the day of the surgery, the next day, and then the following day, etc. And they list in the instructions all these items that I'm going to need, such as a nasal rinse, and I'm going to need gauze pads, and I had to go buy some distilled water to use for the nasal rinse, and so all these different Vaseline and Q-tips and hydrogen peroxide. Those are some of the other items I needed to purchase for the recovery process. So I went out and purchased all this, all these items, and had the tests done. And so it was a lot to do, actually, but I got it done. It wasn't too much of a problem. And then he called me after getting the blood test the next day, and everything pretty much seemed fine, just to check in with me. And looks like now I'm ready for the procedure. And I think I think he's prepared me well. He's discussed everything that's going to happen, and then the surgery center is not too far away. And I've watched a bunch of other YouTube videos on people who've had septoplasties or sinus surgeries, and so it's really helped me to see their video to help prepare me, because a lot of the things that these other people have had done, a lot of it has been the same, which has been consistent. So I know to possibly expect that as well. And then there have been others, since every person's case is definitely a little bit different in some way. There have been people who had different experiences, minor, major, here or there. So I know that may happen as well. Mine's not gonna be exactly like everybody else's, but maybe in the ballpark for most people. And then there's gonna be some, outliers and whatnot. So I just kind of want to see where my experience falls into, compared to everyone else's. But in addition, also to kind of inform others of what, happens or what occurs or during a sinus surgery and septoplasty with turbinate modification, just so other people can be informed, just when making decisions or when they're going to go through the process. I think documenting my experience will, add to the mix as well as help others. Hopefully, that's the goal. So that's it for now. And next up for me is the procedure, And I don't know if I'm really looking forward to it. It's one of those things that, you're looking forward to it because of the final results and hopefully getting able to breathe and get rid of sinus pressure headaches. But then on the flip side, the recovery process, there's a lot of consistency on pain afterwards and just discomfort. And not looking forward to that part, but I'm still open. Everyone's different. I'll see how it goes. But until then, off to the procedure. All right. Now, in preparation for my upcoming septoplasty turbinate modification procedure, I was given instructions of the items I will need during the recovery process. Now, this is a good idea to have this information up front, because before your procedure, you can go out and buy the items you need, bring them home, set them up in a convenient location, read any instructions so you know how to use them, and be prepared. And that's much better than after the surgery having to maybe go to the drugstore to find something you need and they may not have it, or you may have to go to multiple drugstores if they're out of stock. Or if you're going to order something online, it may take a day or two before it gets to you, and you need it that same day. So it's a good idea to have everything up front and be ready for after the surgery. So now I'm going to go over the items now, but first I wanted to say, I'm definitely not providing professional medical advice, but this was what was recommended for my specific recovery care. And, other procedures may be different. So definitely speak with your medical care professional or doctor on what they recommend for your specific recovery care. So after the surgery, I'm not supposed to blow my nose for 10 to 14 days, and I'm supposed to avoid trying to sneeze. And what's really hard for me is I'm supposed to avoid exertion and athletic activities since I like to run and go to the gym. None of that for about 10 days. And I'm supposed to sleep with my head at about a 30-degree angle. And then I'm supposed to wear this nasal mustache, which is like gauze underneath your nostrils. And it's held up by tape, being taped to your side of my cheeks. So it's going to be pretty different. And, going down the instructions, the first thing they talk about is pain. And they recommend taking Tylenol. And so I have a bottle right here, just generic acetaminophen for me for pain. And that's what they recommend. So I've got that already. And the doctor did a prescription for me for antibiotics that I'll have to take after the procedure, as well as a stronger pain medication here. So he wrote those prescriptions out. I got them early, so I have them already for my procedure, as well as the acetaminophen. And after the surgery, they also recommend using a nasal sinus rinse. And I'm supposed to do that about between 3 and 4 times a day. So I ended up getting this Neilmed sinus rinse, and they have all different kinds. And I picked this one. This one has a bottle, and it comes with the sinus rinse packets. And they have other ones like the Neti Pot, and there's also generic versions too, and you can find them online as well. But I just went with this one. It came with 50 premixed packets. I thought, okay, that should be good enough for now. I can always buy more if I need to, but that should be good for starters. And this is the bottle, and just a pretty good sized plastic bottle, and it goes up to 240 milliliters or 8 ounces. And the top just unscrews. And of course, I'm going to clean this, of course, before I use it, disinfect it. And there's the tube that goes into the top. And then what you do is you mix water and the sinus rinse packet, which also comes in the box. And there's the 50 premixed packets of the saline nasal rinse. And so I think that should be good enough for starters to keep me going. And if I need more, I can always get more. But they also mention when you mix this in with the water, what you need to do is use distilled water. And here we go. I have some distilled water ready to go. And after rinsing, in between rinses actually, they recommend to keep your nose moist, nostrils moist, you can use a nasal mist. And so I got one, CVS here, once again. So I'm ready with that too. And I actually have backups. I actually bought a few of these, and there's plenty more waters as well. And that is going to be done starting the first day of the surgery. And then starting the next day, I'm supposed to clean my nostrils using a mixture of half hydrogen peroxide and half water. So here I have the solution, hydrogen peroxide, and pretty big bottle here. So hopefully this should be enough. And then, as you can see, I've got the distilled water to use as well. Still there. And you're supposed to use cotton swabs, and I've got plenty here. So basically, you dip the cotton swab in the solution of half hydrogen peroxide, half water, and just to clean out the nostrils daily. Now, after cleaning, the instructions recommend to put some petroleum jelly underneath the bottom of the nostrils to keep them moist. So here I got petroleum jelly, CVS again. And this is a pretty huge container of it. Now, from like Moby size, but that was the only one they had. That's why I got it so big. So I'm prepared for the next millennium of petroleum jelly, or with petroleum jelly. And finally, in order to catch like any, draining of the nostrils and whatnot during this recovery, I have gauze pads. Now I bought a big packet of them here. These are the sterile pads, and they're the 3x3. And I'll be putting those underneath my nostrils and using tape to tape them like to my cheek, basically, to hold up the gauze underneath my nostrils. So I just bought this set of tape, so I'm ready for that. And that's pretty much it. Those are pretty much the items that I'm going to need during my recovery process. Now, I also see the doctor for the 3 following weeks, once each time for the 3 following weeks. So if there's anything that needs to be changed, or if I need different medication, or the amount of time I'm rinsing needs to be increased or decreased, he'll be able to let me know as he checks up on me. So these are pretty much the items for now, and hopefully for the entire process. Hopefully I don't have to buy any more. But looks like I'll be ready, and I'll let you know how it goes. Well, it's the morning of my surgery, and I'm a little nervous, but I'm thinking things will go okay. I hope. I hope I don't end up kind of looking like the guy on my shirt here, but I guess we'll see. Well, I'm here at the surgery center, and I have to wait in the lobby due to COVID, but looks like I'm up next. I'm in the surgery center waiting room, and I'm waiting to be called in. I'm in the bed just right before surgery, and I have the IV in, and it looks like I'm ready to go.
Okay, I'm in the recovery room now, and it seems like it's been a couple hours. The last thing I remember is being in the operating room, and now I'm here. And the nurses have checked on me, and my throat is like really, really sore. But they say that's normal, and I'll see how it goes.
Well, it's the first day
after the surgery, and I haven't been feeling all that well. Mainly a lot of pressure behind the nose and the cheeks and my forehead, and I didn't get a lot of sleep because of that. Maybe a couple hours at most. And I have been taking the pain medications and the antibiotics as prescribed. The doctor did take out the packing today, which he said would alleviate a lot of the pressure that I had been feeling. And it didn't it wasn't very painful, but it seemed more of discomfort when he was removing the packing. I was expecting a little bit more pain, but it was just more discomfort. It made my eyes water, and but it wasn't as bad as I thought. But I still do have to keep the gauze mustache because my nose still did bleed a little bit, and it's still draining a little bit of blood some more. So now I'll just continue with the other recovery process, maintenance as needed with the rinsing of the nose and cleaning and the nostrils and whatnot. So that's where I am so far.
Well, it's the second day after the surgery, and I'm feeling much better. There's a lot less pressure in my sinuses compared to the night of the surgery. And yesterday, the doctor removed the packing in my nose, and that alleviated even more pressure in my sinuses. I did remove the gauze mustache for this video, but I'm gonna have to put it back on after because when I sit upright like this, mucus and blood start to drain down my nose. So I'm supposed to still lie on my back and with my head tilted or angled so the mucus drains backwards instead of coming down my nose. But I'm also supposed to use this nasal spray to keep my nostrils moist while they're healing. And I mean, you can tell I'm pretty congested right now, but that's a good thing because the mucus is draining instead of building up congestion and pressure and staying in my sinuses. And that was one of the reasons why I wanted the surgery to begin with. But I'm going to still continue to rest and follow the doctor's instructions of lying with my head back right now. And just wanted to give an update. Well, it's day 4 after the surgery, and I'm actually starting to feel a little bit stronger. I thought I was feeling better yesterday on day 3, but I was getting these bouts of fatigue and feeling really tired and like a little nauseous too, and even like a little loopy. And then I started thinking, well, maybe it's the combination of the anesthesia wearing off and the pain medication that I was taking and the antibiotics, and then just the trauma of the surgery as well, just, adding up, just the aggregate of all that. So, but today I'm a little congested still partially because of the weather, but just the drainage is constant. And I've taken off the mustache. I can kind of deal with that now. I keep my head tilted back, or I just use some tissue to kind of wipe here. So the mustache is gone, which helps. But what really, really helps is using the nasal spray. This is a must. I mean, I've learned that right away because the drainage in your nostrils, it starts to dry up at some point, especially at night when you're trying to sleep, and it crusts up, which is gross, but it blocks the airway. So it's obstructing the nasal passage, which is the whole point of getting a septoplasty. And so I found that keeping it moist definitely helps. And the other thing that you want to do is use your hydrogen peroxide along with the cotton swab, half hydrogen peroxide, half water mixture on the edge of the cotton swab, and then just wipe around the inside of the lower part of the nose to keep that clean. And that really helps too. And because stuff just starts crusting up, because even if there's no mucus running out your nose, it's still there.
and it's still alive, and letting you know that I still feel congested right now, but it's draining and it's not staying in my head and building up pressure like behind my eyebrows and cheeks, and where it used to, or like behind my nose, and then just give me a sinus pressure headache. It's draining, but that's part of the surgery, and as well as the weather right now. It's just sort of the timing too. It's like really, really windy lately, and I think that's driving some of that too. But overall, I'm feeling stronger. I'm eating more, and I'm looking forward to the next visit with my physician. He told me for the first week not to use the NeoMed rinse, which I mentioned earlier. It has those little packets that you put in water, and it's like a rinse, and you squeeze the bottle nozzle in your nose, and it comes out the other side. He told me to wait till the second week to start that. So I'm following his instructions, and I think it's okay to do that. I'm still able to breathe through my nose, somewhat. Yeah, so I think things are going okay. I'm looking optimistic on the way things have been going so far. All right, well, I'll keep you posted with the next update. Well, it's been 1 week since my septoplasty and sinus surgery, and I'm feeling much better. For a couple days after the surgery, just out of the blue, I would feel really tired and winded and weak. And I think that was probably the anesthesia wearing off, because I haven't felt like that for the past couple days. I don't have to wear the gauze mustache anymore. There's no blood draining from my nostrils anymore, thank goodness. And I did see the doctor, and he did give me the examination of my nose, and he said everything was healing well. He irrigated it. He also removed some black dark crust that was up in my nostrils using that vacuum kind of suction thing they use. And he did also give me the okay to start exercising again, because things were healing well. I can start running again and going to the gym, so I'm really happy about that. I do have to continue to still use this sinus rinse. This is one thing that I've been using, is this NeoMed sinus rinse kit. It just has like a bottle, and then you mix it with these sodium packets, and then you flush out your sinuses. This is the bottle right here, and you're supposed to fill it up with distilled water, not just tap water, and then you mix it with the little sodium packet, and then this is the part you put up next to one nostril, and you squeeze, and it flushes out your sinuses, and it drains out the other nostril. So that I have to continue to do that to keep the nostrils and moist and the sinuses clean. And then this is the sodium packets that they give you. They give you 50, and here's what they look like, just these like little packets. And you mix this with the distilled water in the bottle. So that's pretty easy. About 2 times a day, I think, is recommended. And in between, I still have to use this nasal mist spray to keep the nostrils moist, like I keep mentioning. And this is pretty easy. This just takes a second or two to do. And I do it about 3 times a day. And that's supposed to keep just your nostrils moist and not accumulate any more crusting of blood and whatnot, or mucus, as the healing continues. So that's my 1 week update, and everything seems to be going okay. Well, it's been almost 4 weeks since my septoplasty and sinus surgery, and I'm feeling really, really good. I've been exercising, I've been able to go to run, and I've been able to go to the gym, and I'm not getting tired anymore. For a few days after the surgery, I just out of the blue would just get really, really tired and winded and weak, and I think that was the anesthesia still wearing off. So that went away after a few days, finally. And the only thing is my nose is a little bit tender, and it almost feels like if I walked into a door and hit it really hard. But that's about it, really. It's definitely getting better every day. And I pretty much just have to continue the sinus rinse. I'm doing that daily, and then the nasal mist to keep the nose moist. and those are going fine. There's not really much, bloody mucus like there was before. It's actually doing pretty well. And I did have a follow-up appointment with the doctor, and he said everything was healing well and going great. And but he did also recommend a new sinus rinse that had a steroid in it. He said that would help the healing get better, and so I'm waiting for that. But everything else seems to be going really, really well. I mean, I basically had two goals for the sinus surgery and septoplasty. One was basically to be able to breathe through my nose, which I've never been able to do before. And two was to reduce the sinus pressure headaches that I kept getting, on and off, but kind of regularly almost. And I'll definitely say I can breathe through my nostrils, breathe through my nose normally, where I never was able to do that before. And it just feels so different and so weird, and but great. I like it. It feels a lot better to be able to breathe through my nose, for the first time in my life. And the sinus pressure headaches have also reduced. I've gotten a little bit of pressure a couple days, but considering the amount that I used to get, the frequency has completely diminished, and I think has definitely had an impact on that. So I'm really happy about that. And for me, the sinus surgery was definitely worth it. I am feeling the benefits of it, and it was definitely the right decision for me. And I wish I had done this like years ago. I wouldn't have had to put up with all the pressure headaches, or as many, or been able to breathe through my nose sooner. So yeah, it's been a really good experience. And I think overall, the main tips or advice I would give if someone was going to get septoplasty and sinus surgery is, I think the first thing would be just prepare everything in advance as much as you can. And I mean, like, go buy your prescriptions and have those ready for after your surgery. You might also buy the sinus rinse and all the materials, the gauze you'll need for like the mustache. And I think, that was definitely a tip that I'd highly recommend. And, also prepare your loose clothes to wear the day of the surgery, like t-shirts and sweatpants or something that's going to be very comfortable. Have all that prepared early, and as well as, your bed when you come back and you need to rest. I would say definitely have all that prepared ahead of time. That will definitely keep you feeling better. Things will be just a lot easier in that respect for the whole recovery process. Because for me, I think that first night was the worst, having to try to sleep with the packing, and that was causing some pressure and discomfort, and taking the pain medication every so often. So having all that preparation done in advance and sort of pre-mapping what you're going to do and when you're going to do it, I think that definitely would help. That's probably my number one advice or tip. The second is, and I had heard some other people talk about this in their experiences with the sinus surgery, is that after the surgery, their throat hurt. And I didn't think that was going to happen to me. I figured, oh, okay, I've had a couple other surgeries and my throat never hurts, no big deal. But it happened. After the surgery, my throat completely was hurting. I mean, every time I tried to swallow, it felt like knives were like cutting my throat. So it was really bad, like a super, super bad sore throat. And I think a way to get around that, and this really helped, is that, before Karen had made some Jello and some coconut pudding. And so when I ate the coconut pudding and the Jello she made, it kind of coated my throat, and it made it a lot easier to eat other things and swallow after, the throat was coated with the pudding. And then Jello kind of dissolves easily the consistency of Jello was smooth, and it didn't really hurt so much. But coating the throat with the pudding is what really, really helped me get through that first day. I think about a day and a half is how long it took before the throat started to feel a little bit better. And I also thought you could probably use cough drops, but then they usually sometimes have a funny taste or they're really strong. And, trying to eat food with a cough drop, they have like licorice flavor and cherry flavor or menthol, and it just might not mix with it when you want to try to eat food and, you're not feeling well, and just to add something else so strong might not be the best, but it would probably definitely help having a cough drop too at worst. But overall, I think the main thing is to prepare everything in advance. That really, really helped. But overall, to wrap it up, I think it was definitely a positive experience overall, because I've got my nose I can breathe with now, and sinus pressure headaches have definitely reduced a lot. And I think it was definitely a good experience. Like I said, I wish I'd done this long time ago, but sure. I'll just wrap it up here, and if there's any questions or comments or about my experience or any other any other questions you want to ask, just ask in the comments, and that's going to be it.